So welcome, Justin. Thank you for joining me today. I'm super excited to talk to you. Thank you for being here and helping me in bringing awareness to infertility, in particular, male infertility. Do you mind sharing a little bit about yourself, what you do, and how you got started?
Yeah, absolutely. Well, thank you for having me. My name is Justin Houman. I'm a urologist and male fertility specialist here in Beverly Hills. I'm a urologist by training. So during my training in urology, I noticed there's this huge gap in male fertility needs amongst patients, men's health needs, and more importantly, what we're starting to figure out is that guys who have male fertility issues or male fertility is a great proxy. It's a great assessment of your overall health. So it's a good opportunity to not just address male fertility issues, but also helping men address overall health issues that could potentially become chronic conditions as they age. So it's a unique opportunity, and obviously it's a field I'm passionate about in terms of helping people with their reproductive goals and then maintaining good health going forward.
Wow, that's so interesting. So it's kind of like you could affect your own infertility. I can't wait to get to that because it might be different from a female experience. But my first question is, what is the most common cause of male infertility?
So, I mean, it's a few things. So when you think of infertility, there's four things, at least for male infertility, there's four things I like to say. First off, it's anatomic, right? You have to think of any anatomic issues. So things such as, not having a testicle or having lost a testicle due to cancer, trauma, whatever it may be, that could potentially impair your fertility. The other thing within the anatomic category, there's something called varicoceles, which are varicose veins of the testicles.
Okay.
Testicles like to live within a very fine, very narrow temperature range. So the varicoceles increase temperature around the testicles, and that impairs fertility. We know that. Other things are people are born with it. Well, sometimes people are born without vas deferens, the tube that connects the testicles to the urethra.
Okay.
Second thing you need good hormones. So a hormone assessment, typically just blood work, really gives us a good sense of what's going on. Third thing, this is probably one of the most common ones, is lifestyle factors. Things such as smoking, drinking, hot tubs, steam rooms, putting your laptop on your lap, anything that really exposes your testicles to increased temperature, radiation.
I thought
Um,
that was a myth, the hot tub. I thought that was a myth.
it depends how long in the hot tub. Any type of heated environment, if you're doing it for short periods of time, it's okay. But if you're sitting in there for 45 minutes a day, every day, that does cause, I mean, permanent damage, but no, but it could potentially cause temporary damage to the current sperm that you have. And then lastly, genetics. And this is the one that it's a difficult one for us now. There's probably hundreds of genes that control fertility. Today, in this day and age, we only know 4 that we can test for. So that's a work in progress from our standpoint. But yeah, those are the 4 things that you actually need. Or there's a genetic component. There's definitely a genetic. In some situations, there's a genetic component to infertility. But also sometimes it's, hey, listen, you were just the way you were
Born.
created, the way you were born. There's a gene that doesn't allow you to produce sperm.
Wow. Okay.
Yeah.
And if I can rewind a little bit to the hormone imbalance that you were talking about, what hormone are we talking about, and particularly when it comes to men and fertility? By that.
The main one is testosterone. Obviously, you need testosterone. Sperm need testosterone to grow and to mature and to be healthy. And I'm talking about testosterone that's naturally made, not exogenous, not like from the outside world, injections. That actually kills your fertility.
Wow.
Um, and
Interesting.
this is something that I see tons of patients who are on testosterone. They come in, they're like, I have no sperm. And you're
Wow.
like, yeah, it's because you're on testosterone. They're like, no one ever told me that. So that's a very common one. There's nothing wrong with being on testosterone as long as you understand that you could impair your fertility,
Yeah.
not permanently, but definitely temporarily. You could impair your fertility.
Wow.
So you need testosterone. Then estrogens, it's the balance between testosterone and estrogen. Every guy has estrogen in them, but it's that fine balance.
And so tell me a little bit about how you can treat male infertility.
Yeah, it's, really what it comes down to is you want to figure out what's causing it, right? So amongst those four things, once you diagnose it, then each one of those four things has a different treatment plan. So if it's hormonal, for example, there's things we could do to naturally increase your testosterone levels and provide that sperm with a good environment for them to grow and mature. You can naturally increase their testosterone if it's a hormonal issue. Let's say it's a varicocele, right? Let's say the varicose veins of the testicles. That's a small, it's a minor outpatient procedure. I specialize in doing that. I do it under a microscope. We're able to go in there and just find those veins and only those veins and not injure any of the other adjacent anatomy or adjacent arteries, veins, arteries, lymphatics, vas deferens in that area. So that's outpatient surgery. And then genetically, let's say there is a genetic issue. Where you're subfertile, where you're producing some sperm, but so little that you're unable to actually get it out. In that situation, what we do is we go in there and we actually are able to extract sperm from your testicle, directly from your testicle. Mm-hmm. So to answer your question, you have to figure out which one of those four things is, and each one has its own treatment plan.
Yeah. And what I hear is you're also talking about the preventatively, like how can you prevent it from happening by lifestyle? Do you mind sharing a little bit about that? I mean, college years, I'm thinking everybody's drinking, smoking, also doing drugs. I mean, could that affect male infertility as well?
I mean, like what you did in your college years, or any of us in our college years, it's not going to come back to bite you in the butt now. No. It's sperm needs 71 days from the time of creation to the time where they're able to be ejaculated, right? 71 days. So during those 71 days, roughly 71 days, you want to make sure you're minimizing these toxins or exposures that could potentially harm them. So I'm not saying don't drink, no binge drinking. Cigarette smoking obviously is not good. We all know that. Especially if you do it in high volumes, you're doing it every day. Again, and then the temperature. The temperature is really a very, very important one because you do want to minimize temperature to that area or prevent increased temperatures in that area. So these are the typical environmental things that we talk about, lifestyle issues. In most situations, we're able to figure out an option for you to get sperm, right? Whether it's correcting, let's say we correct you hormonally and you're able to ejaculate sperm. Sometimes you're not able to ejaculate, but we could go in there and remove the sperm. So in most situations, we're able to, as a last attempt, we go in the testicle and we take the sperm out. But like I said, some people are born without the ability to produce sperm in the first place. So that's just something to be aware of.
So my next question to you is, what is the best male infertility test? How does one know that you're fertile? Or
the best thing to do and the easiest thing to do is something called a semen analysis. And you could do it at home or you could do it at your doctor's office. I think there's some online things out there too now, but basically you ejaculate into a cup and you send it to, or you come in our office, you ejaculate in a cup and we look under a microscope. And there's a couple things we look at. We look at, the count, how well they're moving, how well they look, the volume, and a couple other a little bit more technical things. And that gives us a sense of whether you're fertile or you're subfertile or potentially infertile. And if that's the case, sometimes it doesn't require more workup, but sometimes it does. So if that's the case, obviously you want to see a male fertility specialist to make sure everything's okay.
So when would you suggest for a person to come and do these infertility or semen analysis?
Yeah, so if you and your partner have attempted natural conception for at least 6 months without any benefit or without any without achieving your goal, at that point I'd say each of you should get some kind of assessment or workup. So from a male standpoint, it requires semen analysis. And from a female standpoint, it requires a little bit of blood work with their OB-GYN. But the man, at least at the very least, should provide a semen analysis if at 6 months they're still having issues.
Okay. And how can you boost your fertility as a man?
Yeah. It kind of comes back to the lifestyle thing. So things that you can do, the easiest things that you could do is just from a lifestyle standpoint, eat, sleep, and exercise, right? So in terms of eating right, you want to, not to say don't have any carbs or anything like that, but just have a good balanced diet, right? balanced diet of complex carbs, good healthy fats, and as well as lean proteins.
Mm.
Sleep, at least 7 hours of sleep. That's good because what that does is it actually promotes good natural testosterone production, which again, like we talked about earlier, is good for sperm. And when it comes to exercise, any type of exercise in terms of cardiovascular, getting your heart rate up, these types of things. Exercise does two things. Cardiovascular gets your heart rate up, gets good blood flow to areas of your body, prevents any type of, or it could decrease the chance of atherosclerosis, those plaques that decrease blood flow to the testicles. And then number two, when it comes to weightlifting within the exercise, that's good for hormone levels as well, natural testosterone production. So those are the three things that you could do to boost your testosterone, boost your fertility at home.
Is there any medications for male infertility?
Yeah, I mean, there's supplements that we provide to patients that they could take if they are having fertility issues, and these are things like coenzyme Q, vitamin E, vitamin D. These things promote a good, healthy environment for the sperm, but I wouldn't take those necessarily unless you. I mean, you could take them because they're good for overall health, but yeah, I mean, those are the ones that I would say in terms of supplements, but no medications. We have to see what's causing it. It all comes down to what's causing the fertility issues.
Right, because female infertility is kind of represented by all these shots, that you
Right.
take, and that's like the image of infertility. So with that question, I wanted to see, like, how do you treat male infertility? Is it as invasive or?
Yeah, definitely. Some guys have to take shots. The same shots that women take. Guys, yeah, because I mean the same hormones that stimulate ovulation, they stimulate sperm production as well. So yeah, in some situations, guys do take those shots too.
Oh, interesting.
Yeah.
Really? Okay. Um, so, I mean, you and I are going to get together more to discuss more in depth. I want to know about the experience of male infertility, from what you've seen, what you've heard. I'd love to dig deep on that. And also, I'm going to give an opportunity for the followers to ask you personal questions that they want to have answered. So
Yeah,
you and
please.
I can do a Q&A as well. But I think this is a good start. I want to know if you have anything in particular that you want to share that you think will provide good information to kind of give a platform for us to build on when it comes to male infertility.
Yeah, I mean, the one thing I always tell patients is it's male infertility is very common, especially as we continue. Well, guys are getting married at a later age. They're planning on having kids at a later age. So with that, there's a chance of having poor semen quality, semen characteristics. So that being said, it's very, very common. I think that, there was this thing out there last month about sperm quality amongst guys. It's getting worse and worse to the point that we may be extinct within a couple of decades. Now, I don't want to sound the alarm to say that, but
Yeah.
it's very, very common. So it's not a taboo subject at all. If you are experiencing issues from a fertility standpoint, even from a sexual dysfunction standpoint, a lot of guys, they're unable to perform, or they're having difficulty performing because of the stress of trying to have a kid, and that leads to infertility. So if that's the case, again, I can't tell you how many patients I see on a day-to-day basis who are saying these types of things. So don't think of it as a taboo subject. It's very normal.
The myth is, oh, a man can have a child at any age. He can be 99 years old and have a child, but the woman can't. There's so
Right.
many myths in regards to male and female infertility that I'd love to just debunk her with you to go over, because what you're saying, to like, this is the first time I'm actually hearing that.
Yeah, yeah, yeah. It's male infertility is common. It's very common. It's very common.
Yeah.
So don't feel like you're alone.
Yeah, absolutely. No, we that this is the intention of doing these Q&As with you, is to remove the stigma and allow and give space for male infertility to take space, so that we can start talking about it, because it is, I know, according to numbers, it's like 40% is carried by the burden is carried by women and 40% of the burden is carried by men, and then 20% is either both partners or it's undiagnosed and they just don't know. So it's absolutely there we're equal, but when it comes to like the societal understanding and knowledge and information, it's unequal. We know about female infertility, we talk about it, and the stigma actually lays there, but versus the male, because we just don't talk about it or we don't know enough about it, so we walk around being completely ignorant to the fact.
Right.
So thanks for being here and clearing it up. I look forward to speaking with you soon again.
Likewise.
And
Likewise.
yeah, absolutely.